This is Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman with Juan Gonzalez. As the U.S. death toll from COVID-19 tops 465,000, we look now at the devastating impact the pandemic has had on the disabled. Many states have failed to prioritize giving vaccines to people with serious physical or developmental disabilities, even though studies have shown disabled people are 2 to 3 times more likely to die from COVID. California's faced intense criticism for recently switching to a largely age-based vaccine rollout, leaving out many younger disabled residents with serious medical conditions. There's also confusion in many states over what medical conditions qualify for prioritized access to vaccines. On the international front, the United Nations High Commissioner for Human Rights, Michelle Bachelet, recently appeared on Al Jazeera and spoke out about the pandemic's impact on the disabled.
We know that people living with disabilities, usually they had already unequal conditions, and they are discriminated, and that makes them more likely to be exposed to the virus and less likely to be treated. As you know, in many countries, the biggest amount of people who have died of COVID-19 is people living with disabilities.
We're joined now by 2 guests. Joining us from Oakland, California, is Rabbi Elliot Kukla, who offers spiritual care to those who are ill, dying, or bereaved at the Bay Area Jewish Healing Center in San Francisco. He's a disability rights activist working on a book about being chronically ill in a time of planetary crisis. His recent New York Times op-ed was headlined, "Where's the Vaccine for Ableism?" Rabbi Kukla is also the first openly transgender person to be ordained by the Reformed Jewish Seminary Hebrew Union College Jewish Institute of Religion in Los Angeles. And in San Francisco, we are joined by Alice Wong, founder of the Disability Visibility Project, an online community dedicated to creating, sharing, and amplifying disability media and culture. Alice Wong is also the host of the podcast Disability Visibility and the editor of the new book, Disability Visibility, First-Person Stories from the 21st Century, an anthology of essays by people who have disabilities. We welcome you both to Democracy Now! Alice Wong, let's begin with you. I mean, you use an electric wheelchair. You are on a ventilator. But you are not prioritized in California for getting the vaccine?
Yes, I am not. Just to explain to people a little bit of what the structure is like in California. They are truly vaccinating to people in phase 1A and 1B, which includes healthcare workers, to long-term care residents, to people over 65, and essential workers from several sectors. Now, next step was phase 1C, and that included people under 65 with any disability or health condition and some additional essential workers. So I was supposed to be in phase 1C. And the governor on January 25th announced that he was moving to an age-based system after phases 1 and B are completed with vaccination. And this is when I lost my bleep and got really, really angry. I created a hashtag called #HighRiskCA because I really think people don't understand that young high-risk people exist. And that when we think about high risk, we often think about older people, people who are in long-term care facilities. But there are a lot of people with disabilities and people who are chronically ill, higher weight people, immunocompromised people who are in all age groups. And people need to understand the disastrous impact of this change. If you use the hashtag so that we can mobilize and also hold space for one another, because, the bleep is bleeping real.
And Alice Wong, there are some states, such as Oregon, who have included people with intellectual and developmental disabilities of all ages in the vaccine rollout. Could you talk about what's the differences in some states and which states you think are doing a better job?
Well, I think some states are doing a little bit better job, but the question is lists. New York recently announced that they're going to be, allotting some vaccines for people with disabilities. But there's a lot of questions as to who do they define as high risk. A lot of states are relying on the CDC's list. And, the CDC's list of conditions for groups that are at high risk for COVID-19 is not comprehensive, nor was it even meant to be anything definitive. It leaves out a lot of people with disabilities, and states are using this for their eligibility criteria. And other states are also increasing and adding specific disabilities as well. So this leaves a lot of people out, especially people with rare or undiagnosed diseases. So, for people who want to read more, there's actually a really excellent article published a few days ago by Liz Bowen in Scientific American that talks about, this whole idea of these lists because, disabled people are incredibly heterogeneous, and it's not everybody has a diagnosis. Not everybody has access to care or a primary care doctor. And a lot of these states that are prioritizing disabled people, they have to actually provide proof and verification. And that kind of gatekeeping is another barrier.
I'd like to bring Rabbi Elliot Kukla into the conversation. Rabbi, you've suggested that from the outset, disabled people have been marginalized in response to the pandemic. Could you explain what you see is happening, and also especially what is happening to those who are disabled in long-term care facilities?
Yeah, thank you for asking about that. A lot of my work is serving people in long-term care in all sorts of different facilities. Really, from the beginning of the pandemic, the messaging was, don't worry. The only people who will die or become seriously sick are elders and disabled people and people of higher weight. So in other words, we're really no big loss. Anyone who is less disposable will be fine, so you shouldn't worry, was really the what pretty much across the board was the messaging at the beginning of the pandemic. And that understanding has really led the response to the pandemic, this feeling of being disposable. Even from the very beginning, before there were even medical shortages, there was a threat of medical rationing to elders and people with disabilities. And the pandemic has really, the epicenter has been long-term care. More than a third of COVID deaths have happened in nursing homes, which has been, something that, located in nursing homes felt like an inevitability to me from the way things were playing out from the beginning, and really unbearable to watch play out. And a lot of that has to do with so many systemic injustices coming together in this one location, from lack of government oversight to poor infection control, to the fact that long-term care in its very structure is kind of a pandemic waiting to happen. It's set up in such a way that because of a need less and less public funding and more need to worry about profits, most long-term care facilities depend on a not very well-paid staff, largely of people of color, who are exposed to some of the biggest health risks in society. As we've seen, most of the people who staff nursing homes often don't have adequate sick leave, are often working multiple jobs to make ends meet, and are in a situation with high turnaround, are often living at home with people who are also in high-risk jobs, and people who are essentially exposed to some of the highest health risks in society due to racism and poverty are in this role of caring up close to the most high-risk people, which is really a position that makes both the staff and the residents, really by design, by the very structure of these institutions in society, disposable. It makes both parties disposable. And that's really systems that are very large, very, very deep ageism and ableism and racism, that's deep within the structure of how we think about those things in society, and sizeism.
I'd like to turn to the new Democratic Congress member from New York, Mondaire Jones, speaking on the House floor last week.
Now millions of Americans are out of work. And we must remember that it's people with disabilities, people of color, and especially women of color, who have been the hardest hit. As members of Congress, we must do all we can to ensure everyone, and I do mean everyone, can live in dignity. That's why I support the National Apprenticeship Act of 2021, which will create 1 million new apprenticeships. This bill includes the Apprenticeships Access for All Act, which I am proud to have co-authored with my colleague, Congresswoman Alma Adams. This legislation will help remove racist and ableist barriers to employment from our national apprenticeship system, because everyone deserves a good-paying job, no matter your race or your ability.
So that's Congressmember Mondaire Jones of New York. Alice Wong, if you could respond to this, and also if you could take us through your attempt to get a vaccine.
Yeah, I'm just so delighted that, the representative just talked about ableism and just named it for what it is. I think a lot of people in the public do not know what ableism is, and if they hear about it, they actually deny that it exists. I've been told by lots of non-disabled people, just like, you have a parking spot, you have all these things, you have the ADA, you guys have a lot of perks. And I'm just like, you don't really understand at all. That's, ableism is systemic, and it's really bound up with hypercapitalism and white supremacy. And I'm really delighted to see more people, especially our elected officials, calling this out and talking about it in the same kind of breath with racism. And for me, I've been really nervous, this being a high-risk disabled person. I have a neuromuscular disability, and I use a ventilator to breathe, and I have respiratory failure as related with my disability. And this means that if I get the virus, I will not survive. Like, that is a certainty. So I have done everything within my power to stay safe. But again, as with so many people, there's only so much you can do. I have not left my house since March of last year until now, except one time only in October to get the flu shot. And I'm not alone in this. There's so many people in this country and everywhere that are living and biding their time and just trying to hang on. So, when I was in phase 1C, I thought, okay, I could just hang on. I know supply is an issue. I know the rollout has been really shaky and not so great in California. But at least I prioritized. I'm next in line. But then, the governor made the decision phase 1C is completely wiped off of the state's websites, their state vaccination plan, and it's basically a betrayal. Betrayal by the states to people in phase 1C who were told to be patient and to wait our turn. So I told around, I asked my pharmacist, they don't even have access to the vaccine yet. I'm doing a lot of this kind of conversations with people I know. I talked to my doctor. But, there is really no clear idea when I might have access. And I want to also highlight that something that Elliot said in terms of long-term care workers. There are people like me, people with disabilities, living in the community that have attendants that work with them, that help us with our daily needs. This is another layer of risk on top of our disabilities because it is impossible to social distance. I rely on people to help me get up every day. I am in close contact with them. There's absolutely no way to social distance. And, there's a lot of people who this workforce is absolutely essential. And they, in San Francisco at least, are getting access to the vaccine. My 2 attendants, who are my family members, got vaccinated, but yet I am not. And that to me is not equity, and that to me is not justice.
Yeah, I'd like to ask Rabbi Kukla, you've noted that although disabled people are a prioritized group in most current vaccine distributions, that, quote, we often end up at the back of that line, even though we are 3 times more likely to have chronic conditions that put us at higher risk of dying of COVID-19. From your perspective, how does that happen? How do disabled people end up being pushed to the back of the line?
I mean, I think it's basically ableism. I think there's basically, since the beginning of this pandemic, it's been clear that disabled lives simply don't matter as much. This double message, or maybe it's not a double message, maybe it's a simple message that although disabled people have been threatened with medical rationing since the beginning, that although we are considered so high risk that potentially we can't get medical care if we do get COVID because we might not be savable. At the same time, we're being told that we need to wait for a vaccine, which really is communicating a lack of prioritizing our lives. If we're so high risk, we can't get medical care, but at the same time, we are being told that we are not getting a vaccine right away. That double message or singular message is one of lack of value. And that has really continued throughout the pandemic. It hasn't felt so much like hard decisions are being made in terms of weighing hard decisions, and sometimes disabled people end up at the bottom, so much as disabled people have been easy to expend with since the beginning of the pandemic in all sorts of places, like when it has come to medical rationing, when it's come to vaccines, and when it's come to the sort of public health messaging that we don't need to worry as much since, disabled people, elders, higher weight people will be the ones to carry the brunt of this virus.
I was wondering, Alice Wong, if you lived in New York, if you would have better access. recently, the governor expanded the list of people who are prioritized, actually enumerating issues that people face. For example, if you have cancer, current or in remission, including 9/11-related cancers, chronic kidney disease, pulmonary disease, including but not limited to COPD, asthma, pulmonary fibrosis, cystic fibrosis, 9/11-related pulmonary diseases, intellectual and developmental disabilities, including Down syndrome, heart conditions, including but not limited to heart failure, coronary artery disease, cardiomyopathies or hypertension, immunocompromised state, weakened immune system, including but not limited to solid organ transplant or from blood or bone marrow transplant, immune deficiencies, HIV, use of corticosteroids, and it goes on from there. It's very specific. But even as I'm reading this, I'm wondering, how do people know this? And how do people even get to vaccine sites? Like, you haven't left home, you said, but for a flu shot once since last March. So you've almost been at home for a year. Would you fall into a category in a different state where in California you just cannot get to the front of the line?
I think this is really the real question, right? This is another question of ableism, in the sense of why do disabled people, have to prove or identify or document their disability in order to be prioritized? I understand the need to do that and the need to kind of, have a list, but it really leaves out a lot of people who are just as high risk as I am. And I think that's the real question, is the people who are in power. And I think earlier when Elliot was talking about ableism, I think sometimes it's about also a question of power and a question of political representation. Who in the Newsom administration, major decision makers, are part of the disability community. This is something that really weighs on my mind, because we're often seen as expendable and disposable because we're just not seen as part of their world, or just somebody that is respected just for being themselves. So this is one of the things that's so difficult. The fact that each state and even each county is left to kind of have their own kind of list. And I think this kind of disparity is really unfair and just troubles me greatly, because I want all of us to live, and I want to live. I want all of us to live. And I think we shouldn't have additional hurdles to just get through the door to say we're high risk.